Awesome. Well, good afternoon, everyone, and thank you for joining us for our September 26th TEA LEA webinar. Got lots of things on the agenda for today. A couple of reminders, this is being recorded and the recording will be posted within about a week to the site where you found joining this webinar, as well as all the handouts, and I'm going to show that in just a little bit. Another reminder is the chat feature is disabled, and I see sometimes people raise their hand. We're not going to be taking live responses or live Q&A, but we do encourage you to use the Q&A feature to add questions. It often helps us with clarification and guidance and any FAQs moving forward. And as a matter of fact, Kristen's here to follow up on some questions that were asked from some previous webinars. So it really is helpful when you all engage and ask those questions, but we will not be answering them live. So I am going to take just a second to share my screen as we get started. If I can find the right screen to share. Let me say about there we go. Just as a reminder, Kristen, thumbs up if you can see the webinar site screen. Thank you. So I just wanted to give a little bit of information from today. Dawn Vanderheul's with us, and she's going to be sharing several documents, or excuse me, referring to several documents that are already posted there for you. The ones that she has have an included date on it, so I'm going to have to update these when the recording gets on there, but they're still going to be very useful to you when she goes over them. We do have our special education liaisons here today to share a SPED leadership resource, but I failed to link the link to the resource in today's agenda. So if you are on, you can go back to the September 12th agenda where they talked about it before, and you'll be able to find the link to the resource. And I, in the future, will make sure that I include the links to the resource. And just kind of a backtrack, when you're looking for this particular site, it's in special education, special populations, academics, and then you have to start at home. So that always gives you the path of how you get from the main TEA website to the special education webinars. So, all righty, I just wanted to go over that just a little bit, and I'm going to turn it over to you, Dawn. You're first on our agenda.
Thank you, Anna. Good afternoon, everyone. I just have a brief announcement for you. Stakeholders have asked the Texas Education Agency to gather information to gauge the level of interest in a state-developed IEP digital platform. TEA is partnering with American Institutes for Research, or AIR, to collect this information through a survey. So you're probably wondering, what is a statewide IEP digital platform? It means in all school systems, in other words, our school districts, our charter schools would use the same IEP form with the same required content. While the digital platform is the web-based system for school districts to manage student IEPs. Your thoughts on this topic matter. It is an important issue. It's not been decided. We're putting a survey out because that's why it's called a sentiment survey. We want to know your thoughts about the benefits and then also the risks or barriers. And the survey will only take you about at most 10 minutes. Most of it's drop down, check boxes. You don't have to write long essays or anything like that. The survey will close on October 27th. That's actually a Sunday. The survey is available in English and Spanish. We would like to hear from our families, our community members. We have a flyer for you that you can post. The flyer, again, is in English and it is in Spanish. It has the link. You can click on the link, or you can use a QR code. You can just put your camera up to the QR code and take the survey. We ask you to share this among your staff, among your community, among your families. The more feedback we receive from you, it surely will be appreciated. It will inform the sentiment. So there's another word for you. That really is all I have. Thank you, Anna.
Thank you, Dawn, for sharing that information. And again, where I had showed you before, when you join this webinar, you will find the flyer that Dawn referenced in both English and Spanish. that eventually will have the October 27th date, but just keep that date in your mind. And then there's also a presentation, like a slide deck that you can use to kind of share information with parents or staff if you need further information. So, but thank you, Don. I appreciate it. And next on our agenda, we have Kristen Mogari, who's come back to share a few of the questions to answer, or excuse me, answers to questions that were asked when you were here before, Kristen. So thank you for returning and following up with us.
You are welcome. Thanks for being with us today. I am going to hopefully be able to share.
It's showing, the slide deck showing perfect. So
okay, awesome. All right, so yes, Anna asked me to come back, and I just want to give you a couple of general updates and then follow up with some Q&A with what we've been asked either in the chat or in the Q&A function in the last several or the last few webinars. So first thing, in terms of general updates, we wanted to give a couple of SHARS updates. So of course, SHARS is School Health and Related Services. So there was an email sent out on September 6th and also yesterday on September 25th. So we're helping HHSC share that information in case it didn't reach you. But essentially, if you participated in SHARS for fiscal year 24, you're not required to complete this October reporting survey. So this is so where it says who only participated in SHARS, it doesn't mean like that was your first time participating in SHARS. What it means is that if you only participated in SHARS in relation to all these other sources of funding that are listed in that rule, you are not required to fill out that particular survey. So I wanted to make sure, check your emails from the provider finance department if in case those got missed. You can always email that particular email there at the bottom if you have questions or don't quite understand from that. Another SHARS update, of course, is some new policy updates that will be in effect as of October 1st. So there is a link there to the website where you can find the description of those changes. And then, of course, on October 1st, the Medicaid Procedures Manual will be updated with this information. I meant to say before I started, as soon as I get this presentation made accessible, I'll get this posted at the same link that Anna mentioned on the webinar page. So you will have that as well. All right, and then just another update in terms of HHSC, Health and Human Services Commission, and their work with SHARS. They recently established a team of employees they call the School-Based Medicaid Resource and Training Team, or SMART team. That team is really designed to provide technical assistance to school districts and charter schools and service centers in the implementation of SHARS and SHARS program requirements. So you'll see a couple of links here in terms of just sort of their general webpage, the SMART team's webpage, and then the list. So what they are doing this school year is making a concerted effort to visit school districts and charter schools to just introduce themselves and to help with any particular questions that school districts have. So I wanted to share that. The list there is that second link. And then there are different email addresses, excuse me, if you have questions. So if you have policy questions related to SHARS, you can email that to Medicaid benefit request at hhsc.state.tx.us. And then if you have particular billing questions, that's the provider finance department. So you can email at that address. And then if you have particular IDEA related requirements and how those impact SHARS, you can email our TEA email box at shars@tea.texas.gov. So we're working collaboratively with inquiries that we get from the field. So if you send one to our SHARS email, we may, go ahead and forward that to either the policy or billing email at HHSC if they're more equipped to answer that question. But we are attempting to work together and to help get more communication out to LEAs. All right, so another announcement that I just wanted to make in terms of general updates. So we've had, in the last few weeks, we've just heard some confusion around the rule that we changed in relation to non-public or non-district operated day placements. So that's 19 TAC 89.1094. So this rule was formerly referred to as off-campus programs, and we changed the name and of that rule, and put some more detail in about what programs were applicable to this particular rule for non-public or non-district operated day placements. We've heard some confusion and some some frustration around that particular rule that just maybe wasn't anticipated. So one of those concerns has been some funding implications. And so I don't have specific information at this point, but I did want to say, we've heard that the concern and the communication around that, and we will issue some additional guidance in the coming days and weeks to offer some flexibilities around a potential negative funding impact. So we will be in touch with that or about that. Okay, so I wanted to just kind of go through some of the questions that had been asked in the last few webinars. These questions really are in no particular order. It's kind of a hodgepodge, but I did just want to address some of those that were asked. And these primarily are about recent rule changes, understandably so. So, and again, in that webinar page that Anna referenced, you can access to those we have those two back to school documents that's just kind of trying to, give you a summary of rule changes. You can access those from previous webinars as well if you have some questions, or of course, if you have questions about the rules themselves, continue to ask us questions or send us questions. So first question here is around the homebound instructional arrangement or home-based instructional arrangement. So the question here is, do we not need medical documentation for homebound any longer? So there generally for homebound, there are a couple of reasons you could use homebound or home-based. The first primary and most used reason is for medical reasons. And so medical documentation would still be necessary if the student is being considered for homebound because of medical reasons. So a child between 0 and 5 years of age could be served through home-based instruction without medical documentation. But if you are considering homebound for a medical reason, then yes, medical documentation would have to occur with the ARD committee's consideration. So again, I think the follow-up question too, with this, again, with the 3 to 5, is a physician statement required for the homebound instructional arrangement for students 3 to 5 years of age. And so if you are, so children between 3 and 5, and really 0 to 5, because you have your 0 through 3 ECI students too sometimes. So homebound or home-based instruction can be used for students 3 to 5 if the ARD committee determines that to be the most appropriate placement. So it could be used for medical reasons. In that case, it would be required to have medical documentation. But if you have students between 3 and 5, if the ARD committee determines that homebound is the most appropriate placement, that does not need to be for medical reasons. Hopefully that clarifies that a bit. We've received a lot of questions around developmental delay. So if you recall, that is developmental delay is a eligible disability under IDEA and the federal regulations around IDEA. States can choose to use it. They don't have to. Texas has traditionally not used that. And so we are beginning to use this particular eligibility category. And so we've had quite a few questions around kind of the definition and sort of the timeline for use of this disability, students who transfer with that type of eligibility. And then we've had some questions about TSDS and PEMS reporting around that disability. So I wanted to mention kind of each one. The first one, of course, is the definition. So this is in your, of course, in the rule at 19 TAC 89-1040, which is your eligibility requirements. And so a student with a developmental delay is one who's between the ages of 3 and 9 and who is evaluated for at least one disability category. And where you see paragraphs 1 through 12, that just means in the rule, you have all the other the IDEA eligible disability categories. So one of the questions we had been asked is, do we still have to have, kind of an area or another disability that we are concerned about? And the answer is yes. So essentially you're evaluating for one of those other areas in IDEA and in our eligible disability criteria. But what happens during that evaluation is that the data is indicating a need for special education and it shows evidence of, but it doesn't clearly confirm that suspected disability. And so in those cases, an ARD committee could determine that the data supports identification of developmental delay instead. And so those areas of developmental delay are physical development, cognitive development, communication development, social or emotional development, or adaptive development. And so to use this eligibility category, you would have to meet one of the following criteria. So this first one is about what would have to apply in one area of development. The second one is in relation to at least 2 areas of development. Or C is a body of evidence from multiple direct and indirect sources that clearly document a history and pattern of atypical development that's significantly impeding the student's performance. So it is an A, B, or C that would indicate eligibility for developmental delay. As far as the timeline for use, you can use, the districts and charter schools can use developmental delay beginning with this school year. What we, of course, plan to do within this school year is to try and get some, pretty robust technical assistance around this eligibility category to get that developed for you for school districts and to make sure you feel comfortable and knowledgeable about this particular use of eligibility. And so we will get that out as soon as we can. But that said, LEAs are allowed to use it this school year. As far as non-categorical early childhood, that is a category we currently use. I want to be clear, of course, that we're not just simply transitioning from non-categorical to this developmental delay. They're very different definitions. So it's not really a transition, but we are, of course, phasing out the use of non-categorical. So non-categorical early childhood can no longer be used beginning with the 25-26 school year. Although, of course, if a student starts that school year with that NCEC identification, they could continue to have that identification until that required re-eval by age 6, because currently NCEC is through the age of 5. Had some questions about students who transfer. So students who transfer into the district with a developmental delay eligibility can maintain this eligibility if the district, of course, follows the requirements around transfer students, so in-state or out-of-state transfer students. And the ARD committee has determined that the identification meets one of those criteria in our 89-1040 rule. So one of those A, B, or C's. In terms of TSDS PEIMS, there was a kind of an edit or correction to the eligibility category of developmental delay. So we did have, of course, the PEIMS data element of developmental delay, but it was more associated with the ECI, your early childhood intervention definition of developmental delay. And so it did narrow it and limit it to those children who are under 3. So that has been updated so that developmental delay can be used starting this school year. And, you know, obviously we've just changed sort of the limit of the age because it used to essentially be 3. And now since developmental delay can go through 9, that they would have to be less than 10. So just wanted to update folks that that hopefully we did alleviate that area of confusion. All right, so moving on to a different topic is dyslexia evaluations. So we had a question about outside evaluators who complete independent educational evaluations, if they're required to meet the requirements listed in the dyslexia handbook for the required multidisciplinary team member. And so the answer to that essentially is you know, for an IEE to be paid at public expense, it must meet the same criteria that the LEA uses when evaluating for the same suspected disability, including the location of the evaluation and the qualifications of the examiner. Excuse me, I'm losing my voice all of a sudden. To the extent that those criteria are consistent with the parent's right, of course, to an IEE. So an evaluation in this case does have to be administered by trained personnel and in conformance with the instructions provided by the producer of the evaluation materials. So in the case of a suspicion of disability, one of the qualified professionals required would have to be then an LDT, a person with the most advanced dyslexia-related certification, or a person who meets the training requirements in the handbook. I had a question about the overview of special education for parents form and whether that is required for initial evaluations or for every evaluation. It is required for initial evaluation requests. So it is not required for every evaluation. Of course, never hurts to provide it. But in terms of the requirement in rule, it is required when a request for an initial evaluation is made. I do want to point out one thing that I had been asked, which is a good question. In the SBOE rule about dyslexia and related disorders, there is a requirement to essentially provide parents of students enrolled in the LEA information about dyslexia. One of those items is essentially kind of the steps to the special education process as it's described in the overview form. That doesn't mean you have to provide the overview form necessarily to parents. It's essentially more about kind of the steps in relation to that. So could be that in the communication that you do send out to comply with that rule, it could have a link, you know, to the overview form. But the form, the hard copy form itself is not something that is required. I do also want to throw out that for that same rule, in terms of the parent information that's required, we are very close. Hopefully by the end of the day tomorrow, hopefully that we'll have kind of a sample notification for parents to comply with that rule. So there had been requests for us to, you know, maybe come up with something that our LEAs could use for that purpose. And so we responded to that, and we've created something, and that should be posted here shortly. Had a question about STAR Alt 2 and whether the actual form for STAR Alt 2 participation has to be used, or whether there could be kind of a digital version. And so you know, the requirement is to use the form, but as long as the form is recreated exactly, you know, as it is and you know, TEA's website into a digital version, I don't see an issue that would be a problem. Okay, oops, forgot one. Another Star Alt 2 is just, do we have to include both the Star Alt 2 form and the TELPAS Alt form in the student's IEP? At this point, our special ed rule is the only rule that very specifically requires the participation form to be included in the IEP. Of course, with TELPAS Alt, you need, you know, you do need a statement, of course, in the IEP about why it's required. But as far as the actual participation form itself, currently it's only the Star Alt 2 participation form. Okay, so I had a question in regards to other health impairment. And is a formal other health impairment eligibility report still required to be signed by a doctor, or does any kind of documentation from a doctor suffice? And, you know, I want to kind of, before I answer this, sort of back up that, you know, sort of the formal eligibility report was kind of, I think, just nomenclature kind of, you know, created, you know, by districts to comply with this, and probably by the agency. There was no kind of historical formal OHI eligibility report, as long as it just met the conditions. However, I will say that, of course, with the changes that were made at 19 TAC 1040 in relation to other health impairment, what it does just require the doctor or the other healthcare provider. So in that particular eligibility, there is, I think, doctor, nurse, and PA. You have to look at the rule specifically, but the documentation that's required is documentation that identifies or confirms that chronic or acute health problem. So it does have to meet, of course, the definition of that's in the federal regulations, that whatever this health condition or problem is, that it you know, results in limited alertness with respect to the educational environment. But but what's required is you know, at minimum, just the healthcare provider's essential confirmation or identification, confirmation that that particular condition or healthcare problem exists. So kind of no formal eligibility report is sort of the gist of that. But you do, of course, still have to meet the definition of OHI, and there does have to be medical documentation confirming that condition. Another question was the guidance for comprehensive evaluation of specific learning disability. When will that course be available, since that is a required course in the dyslexia handbook for that trained dyslexia professional? We hope that that is should be available within the next 2 months. We're hoping by within the next 4 weeks, but I'm going to say 2 months just to be on the safe side. So I do know that that is it will be accessible in TEA Learn. It will not have a cost. So we are working as hard as possible to get all of those courses updated. All right, then we had a question on IEP goals. And so in our 19 TAC 89.1055, which is the IEP rule, there we did add some information about when annual goals were required. And so one of the questions that we received when talking about that rule is, if a student is being pooled for behavior intervention as needed, do we have to write annual goals for every single class? Now, I'll say I don't know if the author of the question intended the wording as needed, but that's what I'm focusing on. And as needed, if it is as needed, it is not a requirement to have an annual goal. What is required is if they are removed from a general education setting on a regular scheduled period of time from that particular subject or course, and that subject is not modified. So if it's on an as-needed basis, the IEP goal isn't required. However, of course, we need to watch that as needed, because if the as needed becomes consistent and constant, and it is being pulled from a particular class or classes, then we likely would need to convene an ARD committee to discuss, either other parameters or whether the specialized services would need to be modified. Whew, that is all I had. I don't know why I ran through that, because I knew I had time, but I think I just have been on this overload of getting things wrapped up. So hopefully that was helpful. Hopefully I didn't go too fast. At least it's recorded.
Yes, there you go. And thank you so much, Kristen, because I know a lot of people put questions in, and so it really is nice to come back and, have a conversation about some of those questions that were put in. So, and those of you who may have joined us a little bit afterwards, as soon as the slide deck is accessible, it will be added to the website where you were able to join this, along with the recording and some other things. So, Kristen, thank you so much. I appreciate it.
Of course, no problem. Thanks, y'all.
So I'm going to now turn it over to Beth Garcia and Evan Heckman, because they are going to share a special education leadership resource.
Well, good afternoon. We wanted to just take an opportunity to say that as you go through accessing the information, the calendar really starts with what's coming up. And so one of the things, as I'm sure you're all aware, that is happening on the closing side of things tomorrow is the self-assessment. So I'm sure you've all gotten it in or all about to have it turned in. But if you clicked on it on the calendar, it takes you to an opportunity to click on some of the resources that we have inside the site. So once you click on it there, you can see that it takes you to the self-assessment section of it, where we have linked the website for TEA, we've got access to the rubric, etc. And really what we would want to do is to say, yes, knowing that it's due tomorrow, this isn't too late in the game, but rather what you see in that additional resources section are a couple of tools that have been developed from some regions around the state on how you could use the information in your self-assessment to plan moving forward. If you wanted to look at the PD that would go into maybe going from developed to proficient, or potentially you find yourself at proficient and you wanted to move up to exemplary, it would show you in which one of the compliance and strategy areas who you would need to train and how often you would need to train them. So we think that's a pretty interesting resource. The second one is the tracker there. And really what that allows you to do is a different version of, okay, I know I've got to train. So when I look at each of the compliance and strategy items, who have I trained, but when? And this way isn't a, wait, when did I train those people? What was that about? But rather, you've got it here. It's an editable document. You can track them on each of those areas of training related to each of the strategy and compliance items. So again, another resource you could use as you look to move forward in the self-assessment that you've just completed and building upon next year as you evaluate yourself. So one thing that we wanted to show you, because of what's just happened with RDA just being released last week and coming up, is we wanted to say, again, if you go through the calendar, you'll see that, hey, last week Unmasked RDA was released. So if we click on that within the calendar, then it gives us the opportunity to say, okay, here is A, how you can find the information, B, what are the kind of order of events? So you say, well, I just got my information, it's unmasked, what's next? And you can kind of see that timeline there for that order of events. And then as Beth scrolls down, we've got the resource on, we had a director last week say, you know what, I'm new to my role, I haven't seen that RDA report yet. How do I find it? Well, that information's right here. There's a quick little video and Google slide on how to find your RDA report. So that's a fairly valuable piece of it. But essentially, just understanding that we put together this resource as a site with the calendar in mind of, you link your calendar to this one and you don't have to try to remember, you don't have to worry about what's coming up. We know that all the things related to all the things are in the calendar. So Beth, am I missing or forgetting anything that we wanted to just highlight real quick? Okay. Thanks so much, Anna. We appreciate the opportunity to share. You know, we're here for everybody else. So if we've got something that can be helpful, we sure do appreciate you letting us share it.
Thank you guys so much for joining. And just a reminder to those who are, out in the state of Texas watching us, the link for that is actually in the September 12th agenda for the webinars. And as we move forward and the resources shared with us during the webinars, I'm going to make sure that the link is there. Beth's going to help me kind of make sure that I always include the link in the agenda, but it's a valuable resource. And so a lot of the input from that resource is from you all as ESE directors, LEA directors yourself. So please make sure to continue to share us. So that's all we have for you today. And again, the recording and some updates to the documents, as well as Kristen's document, will hopefully be at the webinar website within maybe about a week. So thank you all for joining us this afternoon. I appreciate it. Bye-bye.